Okay, now let's talk about Plummer-Vinson syndrome. So Plummer-Vinson syndrome, which is associated with upper esophageal web, is named after Dr. Henry Plummer and Dr. Porter Vinson. Dr. Plummer was an American internist and endocrinologist, and Dr. Vinson was an American surgeon. There were two Mayo Clinic doctors who observed cases of iron deficiency and dysphagia in the presence of suspected spasm of the upper esophagus or abnormal angulation of the esophagus. This is Dr. Plummer's picture, and this is Dr. Vinson's picture. So Dr. Plummer initially described this condition in 1912 and Dr. Vinson described it in 1919. This is found mostly in white middle-aged women between the ages of 30 to 70, and the disease has a triad of post-cricoid dysphagia, upper esophageal web, and iron deficiency anemia. So if you have a patient that has these three characteristic things on their presentation, I will strongly think about the diagnosis of Plummer-Vinson syndrome. Okay, this is an endoscopic picture of an esophageal web, which is one of the features of Plummer-Vinson syndrome. And as you can see here on this endoscopic picture, this is a very nice esophageal web. Iron deficiency anemia plays a key role in web formation. Increased risk of squamous cell carcinoma of the esophagus is present in patients with Plummer-Vinson syndrome. That's an important point for step 2 CK as well. And the treatment is iron supplementation and mechanical esophageal dilation.